So I'm Jo Darcy and I'm the Clinical Research Fellow for the OxVALVE study, which is a study of valvular heart disease in the Oxfordshire population. And we are aiming to try to establish the frequency, the prevalence of valvular heart disease in the Oxfordshire population by looking at the over 65s. Valvular heart disease can affect any one of the heart's 4 valves, but it most commonly affects the 2 valves called the aortic valve and the mitral valve. It can cause one of 2 things on the whole. It can cause either leaking of the valve or it can cause narrowing of the valve. Both of these things make the heart work harder and make it less efficient. Over time, that extra work for the heart can effectively tire the heart out, and like any muscle which is working too hard over a long period of time, it begins to work less efficiently and it begins to fail. So what we aim to do with the treatment of valve disease is to intervene before the heart muscle becomes too tired out and before that element of heart failure has occurred. So this is an important area because valve disease is relatively less well understood compared with other areas of heart disease, and we don't know how common it is or the time period in which it's going to progress. The difficulty with valve disease is that unlike many other diseases, it may have existed for some time before patients get symptoms. What's important to make sure is that any treatment that we do for the valve disease occurs before there's damage to the heart that can't be reversed with treatments such as surgery. The difficulty being that symptoms may occur after that irreversible damage has occurred. So what we would hope to be able to look at is whether we can identify more closely when people will need treatment before there's irreversible damage, and make sure that treatment occurs at that time rather than after the damage has been done. Exactly what size population that might be isn't well determined, especially in the UK and in Europe, and we have very few data with which to inform people who provide healthcare resources, and so looking at this is becoming increasingly important. We're very fortunate in that we've got expert cardiologists in valve disease such as Dr. Prendergast here. We've also got a very active Department of Primary Care at the University of Oxford who are very keen to bring their expertise in terms of research into screening into the area of valve disease, and general practitioners within Oxfordshire who are interested in cardiology, in valve disease in particular, who were keen to be able to work with us so that we can actually get this project off the ground. We're very fortunate in the UK in that our system of primary care being free at source is uncommon, and actually trying to do this type of research study, especially in places like the United States or in many countries in Europe, would be extremely difficult, if not impossible. But actually our setup is uncommon and allows us to do this kind of research. We're trying to find out how common this valve disease is, exactly what types of valve disease we're looking at, what is most common and what is going to be most important in terms of requiring treatment, and also over what time period it might be that people need treatment. So we're aiming to capture the number of people with valve disease, but also looking at being able to find out whether people are happy to be examined for valve disease in terms of screening, whether it upsets people or whether actually they're quite comfortable with it and feel that it's worthwhile attending for, and also developing groups of people with valve disease that we can study in more detail over time. So people who are asked to participate are those who are aged over 65, who are registered with the general practices that are participating in the study and who have not previously been told that they have valve disease. Those people are being invited to attend their general practitioners for their first study visit. What that then involves is a study visit that's about 45 minutes to an hour long, during which time we ask them a few background questions about their past health, particularly things that might affect the health of their heart, such as their blood pressure and whether they've had problems with angina, that kind of thing. And we then undertake a scan of their heart, an ultrasound scan of their heart, which is called an echocardiogram, and which takes about 20-25 minutes and allows us to have a good look at the structure and pump function of the heart, as well as looking at the valves in particular to look for any narrowings or leakage that might be there. What we do is we give people their preliminary results actually as they attend their first study visit. So if their scan is normal, we're able to reassure them at that stage and thank them very much for their participation and give them a copy of their results as well. Those people who are found to have valve disease, we explain to them that this is nothing to be worried about, that we will of course be informing their GP, and that we will be inviting them to come to the John Radcliffe for patients from Bampton or Didcot, or the Horton for patients participating in Banbury, and that we will there undertake a further scan of their heart, as well as doing a tracing of the heart and ECG and taking some blood samples for further study. And that they will then, following that, be followed up in clinic under the cardiologist if that is felt to be necessary, depending on the nature and severity of their valve disease and of course what they choose. The majority of valve disease that we are seeing is very mild disease, which clinically doesn't require any further monitoring or follow-up, except we may contact them as part of the study in the future. For those people where clearly there is more to be done, or that maybe that they've got slightly more severe valve disease, then we would recommend to the patients and to their GP that they should be followed up in clinic. Again, it depends on what type of valve disease it is that they have, but in line with current guidelines on the management of valve disease. But for a lot of people with mild valve disease, they would only need to come to that second visit. We will be following people over time using various different national databases, obviously with patients' consent. Then we can follow them up and see whether they need to attend the hospital more frequently, whether being diagnosed with valve disease is also associated with other types of disease affecting the heart, or whether in fact there's no difference between the majority of our patients and those who aren't found to have valve disease.